Hi, I'm Dr. Cici Zhu, and I'm one of the obstetrician gynecologists, and I'd like to talk to you about something called endometriosis. So what is endometriosis? Endometriosis is the presence of endometrial or inside the uterus-like cells living outside the uterus in a woman's body. Endometriosis is the presence of endometrial or inside the uterus-like cells living outside the uterus in a woman's body. This can cause a local inflammatory response that can cause a lot of pain, especially during a woman's period. Sometimes this can lead to infertility as well as chronic pelvic pain. Endometriosis can affect up to 15% of otherwise healthy women. And in women who have chronic pelvic pain already or have infertility, it can affect up to 60 to 80% of them. So how does endometriosis occur? It's actually a multifactorial process that involves a lot of systems in the body. Some theorists suggest that when we have our period, the blood will come out, of course, but it will also go back into the pelvis and bathe the lining of the pelvic structures, and this is what can contribute to the inflammation. Also, it's suggested that some cells can travel through our bloodstream and are in lymphatic vessels, and sometimes the cells themselves can change. There are many different types of endometriosis, and that's why sometimes diagnosis can be difficult. The first type is peritoneal or superficial endometriosis. This is the kind that bathes the lining of the inside of the pelvic organs. And when this happens, it's difficult to see on imaging, but it can cause a lot of pain, especially during periods. The second type is ovarian endometriosis, otherwise known as ovarian endometriomas. These are cysts that are often filled with chocolate-like liquid that can cause pain and infertility. The other kind is deep infiltrating endometriosis, which goes beyond the surface and can actually go deeper into the pelvic structures. Sometimes this can also invade other pelvic structures, including the bowel, the fallopian tubes, the ovaries, as well as the bladder and the other pelvic sidewall structures. Rarely, endometriosis can even grow outside the pelvis and affect such structures like our diaphragm. There are 4 main symptoms associated with endometriosis that should be investigated. When a woman has her period, sometimes they have what we are called the 4 Ds: dysmenorrhea, or very painful menses, dysuria, or painful urination during menses, dyschezia, which is a painful bowel movement during menses, or dyspareunia, which is painful sexual intercourse. The pain that women experience when they have endometriosis can either be cyclical or happening with periods, or non-cyclical, which can happen all the time. Sometimes it can also be related to and be associated with fibromyalgia, bladder pain syndrome, or even irritable bowel syndrome. And of course, like I said, it can cause infertility and pelvic pain in some women. Because the symptoms can often mimic just normal period cramps and pain, sometimes it often is very delayed before a woman can get properly diagnosed. Before, on average, there were 4 physicians and over 5 years of investigations needed before a diagnosis was appropriately made. Unfortunately, a normal pelvic ultrasound does not rule out endometriosis. This is as the superficial or peritoneal kind is often not properly seen. We need to use different modalities, sometimes such as MRI or even targeted expert ultrasound, in order to be able to find what we're looking for. Although our textbooks suggest that laparoscopy or surgical diagnosis is the golden standard because you can actually see the endometriosis lesions, it's not prudent for all women to undergo surgery for diagnosis because surgery does come with risk. Oftentimes, we treat women with endometriosis clinically so that they can get better from their symptoms. Medical management of endometriosis is actually first line for asymptomatic women, and we can often start with something as simple as a combined oral contraceptive pill, like the birth control pill. If a woman cannot have estrogen or needs something else, there are progesterone or progestin-like pills on the market as well that can help when taken continuously to help a woman have her symptoms be better. There are also other medications on the market that help suppress different kinds of hormones so that a woman can feel better as well. Oftentimes my patient will ask me if they need to have surgery for their endometriosis, and I always tell them surgery is a very individualized decision. People need surgery sometimes when they've tried a lot of medical therapies and perhaps they're still getting symptoms through them. Or they've tried some medical therapies and are having some debilitating side effects so that they can no longer be on these medicines. Sometimes they need surgery to help with fertility investigations or treatment. And sometimes they do need surgery to help with debilitating pain, especially if the endometriosis is deep and infiltrating. To summarize, endometriosis is a chronic disease that can affect both the physical and mental health of women of reproductive age. It's important to acknowledge the symptoms because they do have a severe impact on their quality of life. It's important to encourage patients to seek help when they do have the symptoms that I was describing, such as the dysmenorrhea, dysuria, dyschezia, and dyspareunia, so that they can get help early before diagnosis is delayed. And to also realize that treatment comes in multiple ways with a multidisciplinary team so that we can all work together